Video number 2 on the final meeting for MAID, Medical Aid in Dying. Tomorrow, I'm actually going to be assisting in a hospice appointment for MAID, that's Medical Aid in Dying, and I'm reviewing the importance and the agenda of the final meeting before the patient's planned death. The meeting has been scheduled. All are present, sitting in a comfortable circle with the patient as the focal point. It's really important just prior to the meeting that the patient has been assessed and assured to be comfortable and ready for the meeting. Perhaps they might need a pre-medication to make sure they're physically comfortable throughout. Or perhaps if they've had trouble with a lot of nervousness and anxiety, maybe they need an anti-anxiety medication. On the agenda, someone should be assigned the role of parliamentarian, and that's someone to take notes of the meeting so that everything that gets decided will not be forgotten. Again, begin with really gentle introductions of everyone present and make sure all of the names are clearly stated and documented in those minutes. Review who is expected or invited to attend the patient's death. And consider if there might be any risk areas. For instance, will there be a large number of attendees? So is the room large enough? How much seating will be needed? Are there enough chairs? And are there any attendees that might be invited that have concerning behaviors such as overuse of alcohol or drug use? Are there any people who might show up and should absolutely not be admitted? If so, get a list of the names. It's just happened yesterday. So we had to choose someone who knows all the attendees, and they were named and agreed to take on the role of gatekeeper at the door. It's helpful to name who will be the parliamentarian, as I mentioned earlier. In other words, someone who will be guiding the process as it begins to unfold on that day. Perhaps it's a family member, or it might be a volunteer or a hospice team member. Moving on, the patient should choose the time for the MAID event, and they decide when they desire for the attendees to arrive. Since the patient will be receiving a pre-medication, this is 1 or 2 medications called antiemetics that will help to prevent nausea and vomiting of the death medication once it has been ingested. This pre-medication will be given an hour prior to the MAID prescription, and the patient may not want everyone just kind of standing around waiting for that with them during the hour. So really be clear about this. Keep listening right now as we have more to say about the arrangements and how very different it can be with every experience. We're talking about a final meeting. Thank you. Get our booklet, The Hospice Care Plan, and watch us on our YouTube channel, The Hospice Care Plan.